because the body is complex, you need to know how is the therapy. If I want to train a body complex, I need to have a complex technique. If I want to have a complex therapy, I need to have a complex diagnosis. If I want to have a complex diagnosis and complex therapy, I need to have a complex way of thinking. If I want to train myself with a complex way of thinking, I need to have a complex training. For that, the methodology to learn the anatomy. You have two solutions. You work with a complex methodology or with a complicated methodology. Two words totally different for the in philosophy. When you are complicated, you work with a part of your brain. When you work with the complexity, it's another part of your brain. It's another model, another neurologic model for the way of thinking. That means a lot of time now, since half a century, a lot of school work now because of computer, because of a lot of things, directly, linear, clack, 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 quick. I have a lot for the anatomy. The big problem that you have now in surgery, in medicine, in chiropractic, in osteopathy, in a lot of things, they do a lot of descriptive anatomy only for the exam. Because you have nothing to practice with descriptive anatomy. And now for the other one, they are not very quiet. What they do, you have a lot of little applications where it's possible to see the body move in all the 3D to understand the anatomy. But if you want to learn that for you, for your pleasure, no problem at all. But if you want to apply that, that is the worst. The worst what? Because the computer works for you, and you don't train your brain to understand what that means, the direction, that. You look all the time in 2D, and if your brain has not the training to transform the 2D in 3D, it's impossible at the time to apply anything. You understand that? For that, this way of anatomy that I give to you, I don't care to say to you, he attached at this place, he attached at this place, you have no exam, we don't care. Are you okay? But to understand exactly the link, the relationship, the movement in the 3D, that's the most important. It's difficult for you today, it's normal. But believe me, in 2 or 3 years, it's a lot easier. For all your life. For all your life. If you want to know the knowledge of anatomy like a book, today we don't care about that. You have internet. You have the answer. But to understand exactly when you practice, it's not the same. For the therapist, it's an obligation. It's an obligation.